know what's going on in the chat.
Yeah.
So I hope, thank you, Lavanya. So I hope that after this session, you're going to leave the session a little bit wiser and hopefully inspired by what I have to say. So I'm just going to move to the next slide. I was thinking of a title for my talk, and this quote from Mahatma Gandhi, the famed leader of Indian independence, came to mind. The best way to find yourself is to lose yourself in the service of others. And this quote struck a chord with me. How many of you have woken up in the morning and asked yourself, what am I doing in this world? What is my purpose? And you can have a show of hands, and Lavanya, if you can feed back to me how many hands are going up. Lavanya, are you there?
Yeah, just keeping track of people raising their hands.
Okay, yeah. You don't have to give me that number. Yeah, that's okay. A few people. Oh,
yeah, we see a handful. We see a good handful. Yeah.
That's good. Well, for me to find myself, I had to go through a journey, and it's one that I want to share with you today. I see a lot of people raising their hands and getting these pop-ups, so that's great. So my journey began in the UK. That's where I was born. And I was born to parents of Sri Lankan Tamil heritage. And for me, it was everything at home was about the Tamil culture, and everything outside was about the Western culture. And I think a lot of you here during the presentation can relate to that, because it is a tricky balance trying to manage between cultures, trying not to sway one side more than the other, and sometimes even feeling like an imposter in both. Well, for me, things got even more complicated when I moved with my family to Saskatchewan, and to Moose Jaw, Saskatchewan of all places, when I was 8 years old. So I'm going to ask you another question, and this one requires a one-word answer, so you can shoot your answers to the chat. Can anyone guess the name of the moose in the corner of the screen? And this is a tourist attraction in Moose Jaw, Saskatchewan. And I'll give you maybe a minute to think of a response. And no cheaters, no one looking this up. So Lavanya, do we have any takers?
So no one yet. You can throw your answers in the chat box.
Yeah, it's a tricky one. The questions later on are going to be a bit easier. So I do have the tallest moose in our country. So I lived in Saskatchewan for about a year, and after that we moved to beautiful British Columbia, the city of Vancouver. And that's where I finished off my schooling. And I have to say, you know, as if the preteen and teen years weren't awkward enough already, I had evolved this very funny accent that you're hearing right now, half English, half Canadian. So I think that puts me somewhere in the Atlantic Ocean, I guess. So I have one more question for you all, and this one I think is a little bit easier. A prize to the first person who gets this. Who can tell me the sports team that is depicted on this slide? And share your answers on the chat.
Oh, we got it. Abhishek says Canucks.
Yes, yeah, yay, Vancouver Canucks. I'm so happy that that answer came much more quickly. That's great. So we have some Canucks fans out there. So my career path led me to medicine, and as Keshi kindly introduced, I did do my Bachelor of Science degree at the University of British Columbia, and very soon after that I started my medical school training at UBC. And you know, I have to say I've been so impressed by the TARMS representatives I've talked to so far. They've got a good focus on their studies, and at the same time they're finding time to volunteer, which I think is amazing. And I'm afraid I wasn't as varied as them. I did focus solely on my medical school, just moving from rotation to rotation. And it was definitely hard work, but inspiring work. But then in the spring of my third year, my father started doing a bit of strange things. When he was driving, he was making an extra wide left turn. He started getting very clumsy with his right hand. And I was very surprised within a few days of that, him coming down with a full-blown seizure. And days later, myself, the neurosurgeon, and my father were standing at Vancouver General Hospital, staring at his brain MRI. and there was an unmistakable ring-enhancing lesion on his brain, and it turned out to be glioblastoma multiforme, which is the devastating, life-ending brain tumor. And so it was that my father entered into palliative care during my final year of medical school, passing away 9 months later. So this was very much a turning point in my life. Those months after my father died, I was wallowing in sorrow. And amid all that sorrow, I actually moved across the country to Toronto, and that was to start my residency program at the University of Toronto. And I really threw myself into it. And I think in so many ways, it consumed me even more than medical school did. And then one morning, I woke up towards the end of my residency, and I asked myself that question: what am I doing on this earth? What is my purpose? So I'm going to shoot another question to you guys. What are some of the reasons that you chose to go into medicine, or that you are in medicine? And you can just put phrase answers or even one-word answers, and I would love Lavanya to let me know what's happening in the chat. So Lavanya, you can read them out as they're coming in.
Yeah, just waiting for some to come in.
Oh, okay. I know we have some brave souls out there. Otherwise, I'm going to start picking on people.
So we've got Isabel saying to try and mix my interest in science and philosophy. Someone else said fulfillment. Someone else said global health. To bridge the gap between basic sciences, research, and clinical translation.
Wow.
Working with underserved and minority communities is another one. Seeing the positive impact it's had on my family and wanting to do the same for others.
That is awesome. Do we have any more answers to that question?
That's all we have so far.
That's awesome. Those are great answers. And I think tying in a message to all of that is, it all seems to point towards doing some good in the world, going out and helping people. So I think most of us do choose the health profession because we want to be out there. We want to be helping people. And I love some of the really intricate answers that some people gave. I think medicine in a lot of ways is a calling, and it's a vocation, not so much a career or a means to earning a living. I asked myself how tangible that goal is of helping people. And for me, I knew I could do it in family practice. I could treat someone for their strep throat. I could counsel them through a difficult time in their lives. But I also wanted to see if I could affect change, help people on a larger scale and even a global scale. So by 2004, I had finished my residency, and I was doing locum tenens jobs around the province. So I was subbing in for other doctors on leave. And something happened that year, was a life-changing world event. And so I think Keshi gave it away at the beginning, but something happened that year in 2004. And do you want to shout out in the chat what the answer to that is, the world event?
Yeah, so the tsunami, someone mentioned.
The tsunami, yes, that's right. So I think most of us who were around at that time can tell you exactly where we were when the tsunami hit. A major Asian tsunami. I felt sick to my stomach watching the images on the TV. There's one video footage that sticks in my mind, and this is a husband who was dragging the body of his dead wife through the flooded remains of his village, and that memory is stuck in my mind for the last 16 years. It's hard for us to appreciate the scale of what happened. So this was an earthquake, 9 on the Richter scale, occurring about 100 miles off the coast of Sumatra, Indonesia. And it generated waves as high as 100 feet. And it spread across the Indian Ocean, killing hundreds and thousands of people and displacing many more. And it was about 15 countries, I think, in total that were affected. And I know watching the images, I was sitting in my living room and I was thinking, I really want to help. I really want to go out there. And at the same time, I thought this was a bit of a crazy thought. I mean, I barely knew Sri Lanka, could hardly speak the language. I wasn't sure what I was going to be helping out with. But at the same time, I felt drawn to it. It felt like there was some sort of unfinished work for me there. And now in retrospect, I wonder if it was just me trying to find my roots. So I did fly to Sri Lanka in January 2005 with the organization from the US, International Medical Health Organization. And about 20 of us headed out to 3 tsunami impacted districts. That would be Mullaitivu, Barakalo, and Ampere. And I, alongside with the other doctors and nurses on my team, were seeing patients, and these were tsunami survivors who were housed in camps. And we were seeing hundreds of patients a day. As I was talking to these patients, they were telling me stories about the loved ones that they had lost. They talked to me about the tsunami coming towards them like a black wall, curved like a cobra. And so I could really appreciate the fact that these people had first been through the devastation and the trauma of war, and then were being traumatized a second time by this natural disaster. I saw bravery as well in the camp. So I saw a lot of survivors helping and supporting each other. I saw some of the young girls at the camp volunteer for the Red Cross. And then I saw men talking about rebuilding. And there's just so much to speak about this trip. I feel like I can tell you a story about every one of these pictures that I'm showing you that I took when I was there. I think that I learned a lot about human survival during that trip. And maybe I'll focus in on one story. That's those pictures in the corner of those children with their hands up. So I was busy one day working in the clinic in Mullaitivu. I looked outside the window and I saw the American nurse on our team playing with these kids, and she was doing these organized games with them. And I could see the absolute happiness of those kids. Their cheeks were flushed with excitement. They were running here and there. And I felt like their joy was palpable. And I really couldn't see a difference between them and children of any other country. So I began to see hope in a whole new way. My trip was unforgettable. You can see from the pictures here, it was unforgettable. I don't think I quite had discovered my purpose, but I felt myself getting closer. Unfortunately, a few years later, in 2009, things were a lot different for that very same population. This was the final phase of the Sri Lankan Civil War. Carnage was all around, and you had hundreds and thousands of men, women, and children trapped in a narrow strip of land in northeast Sri Lanka, caught in the crossfire. I want to ask you another question. How many of you can remember the Tamil Canadian protests during the first few months of 2009? And indeed, how many of you may have participated? Oh, I've got a couple of people raising their hand. Okay, it's going up. That's awesome. I thought some of you might have been a bit young, but I can still see the numbers going up. That is great. So I'll give it a chance. Yeah. So I remember it very well because I was one of those people that was standing on the streets of Toronto with thousands of others in the freezing cold weather, trying to draw attention to the tragedy that was unfolding. And I think it's hard for us in this country to imagine the kind of trauma that comes about when you're living in a war zone. And I'm going to give a plug to a particular documentary. It's called No Fire Zone, The Killing Fields of Sri Lanka. And it was produced by director Callum McRae, who produced it for the Channel 4 UK channel, I guess. It does come close to depicting the horror of the final months and weeks and days of the war. So if you're interested in learning more about the ground situation, you can maybe watch that documentary. I believe the website is nofirezone.org. So it is estimated that 70,000 people died in that final phase of the war, but it's likely that we'll never know the true number. What we do know was that there were about 300,000 people who were left alive and detained in camps. So they were internally displaced people. So I learned the story of 3 doctors who actually stayed behind during the war, and they were helping the civilian population. In May 2009, they were coordinating the transfer of patients out of the war zone along with the International Red Cross, and they were saving thousands of lives. They were providing first aid, they were doing surgeries, they were doing everything they could to help this population. And when there was a government-imposed media ban, they were some of the few people to get the word out there in terms of what was going on and the devastation that was taking place. In particular, that people were trapped in the war zone, no-fire zone, and being fired upon. The hospitals were facing artillery fire, and the no-fire zones were not actually no-fire zones at all. And this was supposed to be a war without witness. We have to remember this, but there were witnesses getting the word out there. So on your screen, you'll see some of the doctor's statements. And I thought it would be powerful if we could get 3 volunteers to maybe read out the 3 statements. And I'd like you to identify who you are and where you're from and go ahead and read a statement. And I understand that most of you are either in medicine or planning a career in medicine. So I want you to, as these volunteers are reading out the statements, I want you to picture yourself in these doctors' situation and think about what you would do. So I'll pass it on to Lavanya.
Yeah, so if we could have our first volunteer, you can choose to either unmute yourself or maybe identify yourself in the chat before you go. Sure, Darshan, I see that you've raised your hand. You can go ahead.
Hi, I'm Darshan. I'm from Toronto, Ontario. I go to Western University right now, second year medical school. So I can read the first paragraph. Today we can hear the gunfire and the shelling. Yesterday, another 80 civilian casualties were brought to the hospital. Today at around 5:30 a.m., we heard the sound of artillery fire. And this is from Dr. T. Satyamurthy.
Yeah, so the next person, you can raise your hand or maybe identify yourself in the chat or just unmute yourself. Yeah, Lotus.
Hey guys, I'm Lotus. I'm in my first year at Western. So it says, we are doing first aid and some surgeries as quickly as we can. The situation is overwhelming. Nothing is in our control. And that's by Dr. V. Shanmugaraja.
And if we can get one more person for the last one. Yep, Satyitya. Hopefully I said that right.
Yeah, so Saithya, I'm in Ireland right now and in second year medical school. And so the paragraph is, we are unable to treat people properly because a lot of aides have fled the hospital. We go into bunkers when there's shelling and try to treat them as much as we can when there's a lull. And that's Dr. T. Varadaraja, May 12, 2009.
Thank you so much to our 3 volunteers. Thank you. And I think you can hear the emotion in the statements and even in the emotion in people's voices as they're reading it. I want you to remember one person, and that's the one in the bottom corner of the screen. That is Dr. Satyamurthy, and he was director of Kilinochchi General Hospital during the war, and he courageously served in the 2 makeshift hospitals at Pudumadalan and Mullawaikal. And the reason I'm asking you to remember him, because he will make an appearance later on in the presentation. So when I heard that these 3 doctors were detained, they were actually arrested and detained in a facility after the war, and they were being trooped out in front of the television and forced to deny their statements in a very Orwellian fashion. I just couldn't sit still. So me and a group of volunteers, we started the Save the Doctors campaign. And this was essentially a petition that we were addressing to the president of Sri Lanka, demanding these doctors' release. And it was to be signed by international organizations, prominent activists, famous people, ordinary citizens alike. And we tried to sort of gain traction through a website as well. I wrote an opinion editorial, an article that was published in the Canadian Medical Association Journal. This was in October 2009, outlining the case for why their detention should elicit the outrage of the medical community. I mean, these were doctors that were going above and beyond what was expected of them, what they had promised to do when they took their Hippocratic oath. And yet they found themselves being persecuted for it. So my team wholeheartedly believed in the justice of our cause. But at the same time, we knew that the Sri Lankan conflict hadn't received a lot of coverage, so we didn't really know who would care. But a funny thing happened. As the word got out and our campaign spread, we started to get more and more hits to our campaign website. So we knew people were chiming in. And then we started to get more organizations and more individuals signing on. And the more people signed on, the more people and organizations that came afterwards. And it was like a tipping point had been reached and there was no going back. So I'm really proud to say that our campaign got the support of the Canadian Medical Association, Amnesty International, Physicians for Human Rights, which is a Nobel Prize winning organization, among many other organizations and prominent individuals. And you'll see pictured here is Dr. James Orbinski. Some of you may know Dr. Orbinski already. He's a Canadian physician, a humanitarian activist. He was president of Doctors Without Borders when MSF got the Nobel Peace Prize a few years ago. And he served during the Rwandan genocide in 1994, and he wrote a book about his experiences. So we were fortunate enough, he came on wholeheartedly to our campaign, and he became the keynote speaker at our campaign forum that was held on November 2nd, 2009 at the University of Toronto. He publicly defended these doctors. He spoke eloquently about their right to speak about what was going on and the terrible injustice in trying to silence them. So amid all of this international pressure, the doctors were indeed released, and it's an understatement to say that our team and we were thrilled. Our joy was tempered by the fact that we knew that this was just one highlight in an otherwise tragic situation. So I thought I would scan a couple of pages from our signatory list. This is just a couple of pages. But it goes to show you that the harder you work, the more people will sign on. And I have to tell you, some of these organizations did sign on readily without much convincing. And there were others that we had to work on. And it took months to convince some of these organizations to join us, and individuals as well. So a show of hands, how many people are interested in doing some sort of advocacy work in the future? Oh, that's awesome. I've seen the numbers go up and up. Okay, that is amazing. I've already got more than half the group raising their hands. I'm hoping I can convince all of you by the end of the presentation. So for those of you interested in advocacy work, I definitely have some advice for you. Very simply, believe in the justice of your cause. You're going to get a lot more people willing to join you and help you, support you, if they can sense that you're genuine in your beliefs. You want to seek out every opportunity to be heard, fight to be heard. And this is an important point. You want to connect with emotions. So what that means is sometimes when we are watching international conflicts on the television or on the internet, it's hard to get past the numbers. It just becomes so overwhelming and we shut down and we do something else. And I think if the same conflict is told through the experience of an individual or a family, it's actually much harder to turn away because we are emotionally connected to the story. I think for our team, we felt that these doctors' story was a lens by which the world could focus on the plight of hundreds and thousands of men, women, and children who were imprisoned in camps after the war. It's important to set some sort of timeline for your campaign and some very specific and achievable goals. You don't want to be afraid of setbacks. I can tell you in our campaign, we had organizations that shut the door in our face. But if we let that get to us, we wouldn't have achieved what we did. And teamwork is really important. You want to work well in a team. You want to respect and listen to everyone's opinion. And these are the people that you're going to carry through till the end. So you really want to display really good teamwork. And lastly, you want to work really hard, harder than you've ever done before. And you want to be consistent about it. Anything is achievable if you put your wholehearted effort into it. And I have to say, if I had any regrets about the campaign, it was one of my team members who challenged me to get MIA, the famous UK rapper singer's signature. And I really regret I didn't work hard enough to get her signature, but c'est la vie. So I can't leave this topic without bringing up a quote from my personal hero, Dr. Martin Luther King Jr. He was an American civil rights activist, and he said, "Our lives begin to end the day we become silent about things that matter." So as physicians and physicians-to-be, it's important to recognize that we are in a unique position to advocate for our patients, for the community, and that's because there's a tremendous amount of respect that's given to our profession. And we are listened to. We have a voice, and if we have a voice, why not use it? And I could see through this campaign, I could see my focus coming in. I was starting to figure out what my purpose was. So, which leads me to the next phase in my journey. And although I hadn't known it at the time, my volunteer work in 2005 and 2009 was foreshadowing of even more important work to come. I was asked to organize the Develop Northeast Conference in 2016, and this was basically a delegation of doctors who would travel in thousands of miles from northern and eastern province in Sri Lanka to meet with experts, international experts in diaspora, to sort of problem solve some of the issues and the problems they were dealing with. And this was, mind you, in the middle of January in 2017, a very cold time, but that's how important it was for these doctors to make it here for this. And I remember one visiting doctor from Jaffna said something that stuck in my mind, is that perhaps you can help us to see some solutions to our problems that we who are so consumed on the ground might not be able to see. And just delving into the problems, it was very much eye-opening. The fact is that in 2009, tens of thousands of people lost their lives, but there were hundreds and thousands of people left behind, many of them facing uncertain futures. So we're talking about 100,000 war widows, female-headed households. We were seeing gender-based violence, addiction, mental health issues, underperforming students, high school dropouts, the list goes on. And I think a lot of you right now would be feeling the same way I did, which was, what can I do? And it does get overwhelming when you see all the social issues out there. But I think it helps to take a step back. So you want to stop and breathe, and you want to identify a need, a particular need. You want to come up with some sort of plan and a timeline. And I guess the most important thing I'd point to on the slide is the idea of talking to as many people as you can, as wide a net that you can cast. And some of these people may become core team members, but they may not. They may be people who are going to pass you on to other resources, or they're going to be helpful in one way or another. So the idea is to network. And then once you've done that, you want to get to work. So Keshi gave a little bit of an intro. So one of the needs, the priority needs identified at the Develop Northeast Conference was palliative care. And palliative care was only introduced to Sri Lanka in 2015, so it is a new discipline. And so it's underdeveloped in most of the country, and indeed, I would even say around the world. And palliative care is essentially the care of patients who are suffering from disease without cure, who will worsen over time and eventually lead to death. And it doesn't just involve treating the physical symptoms, the pain, the shortness of breath, the nausea, the loss of appetite. I mean, the list goes on for physical symptoms. It's also about providing that very necessary psychological, social, and spiritual support. So Northern Province has a population of 1.2 million. So this means thousands are likely to enter into palliative care each year. And an interesting statistic I found when I went into this topic was 2/3 of patients at Trail Cancer Hospital, which is the only cancer hospital in the north, are indeed in a palliative position. And then another thing that is unique that we've already talked about is the decades of war. And the decades of war in Northern and Eastern Province have left family and social structures destroyed. You're seeing a whole generation of younger people migrating. And you've got patients, a lot of them left alone and some even destitute. The doctors at the conference told us that these are the patients that were falling between the cracks of the system. And for me, personally, it was coming full circle. I knew what it was like to care for a loved one at home who's dying. And I can't imagine the difficulties it would be in Northern Province where there is limited resources and no system to address palliative care needs. So it brings me to an organization, Two Worlds Cancer Collaboration. So through contacts that we gained at the conference, I was able to connect with this Canadian organization, Two Worlds, whose purpose is to assist physicians in other countries to develop palliative care systems and reduce the burden of cancer and non-cancer palliative care. Two Worlds listened to my message to them about this war-affected population that pretty much suffered in silence and are still continuing to suffer. And credit to them, they decided to send an 8-person team to Northern Province to see what they could do to help. And I was honored to be part of that team. The team included global health leaders like Dr. Gayatri Palat from Hyderabad, India, Dr. Stuart Brown from New Zealand, Dr. Meera Rajasegaram from the UK, and Dr. Jonathan Pierce from Canada. And we pretty much spoke to everybody when we were there. We spoke to the doctors and the nurses, the hospital administrators, government officials, university officials, and patients and families. And we got a sense talking to them that there was a need. And in fact, there was a resolve by the locals to address that need. So our team gave various talks at healthcare settings and in the community. And one particular gentleman said something at the Jaffna Managers Forum that I will not forget. He stood up and robustly told us, any one of us could end up in this situation. Palliative care is for all of us. We must support this. And I think that was the overriding theme of our visit. And I'm gonna, before you guys fall asleep, I want to send you out another question. Can any of you remember the name of the doctor? It's in the bottom of the screen in the corner. He's wearing a tie and a blue shirt.
You can just throw it in the chat. Yeah.
You can, yeah. Shoot the answers to the chat, yeah. Do we have any, yeah, go ahead.
The election got Dr. Satyamurthy.
Yes, yeah, that's right, Josh, that's good. So yes, that is Dr. Satyamurthy. That was one of the doctors whose release we fought for in 2009. And it was amazing for me to actually meet him and introduce my team to him. He is now director of Jaffna Teaching Hospital, which is the biggest hospital in Northern Province. And he agreed to help us with our campaign, and he continues to do that to this day. So that was amazing. Coming full circle again. So coming back to Canada, I got to work on the Northern Province Palliative Care Initiative, and I got to do a lot of networking and brought these partners together. And the partners for the initiative are Two Worlds, CANE, which stands for Cancer Aid North and East. They are a UK-based charity that was started in 1993, and they have a branch in Jaffna, and they serve as the on-the-ground partner. And they've been doing amazing work supporting cancer patients since the 1990s. And then I cannot forget IMHO Canada. This is an amazing organization. They were formed in 2008, and they're involved in so many good projects there. They got involved, they are managing the funds of the project, and they're doing a lot of mentorship and on-the-ground work as well. So thank you to all three of our partners. I was able to also network with the Indo-American Cancer Association, and they're a group in the States of doctors of Indian heritage, and they agreed to sponsor doctor-nurse pairs from Northern Province to get training, specialized palliative care training in Hyderabad. And that happened in 2018. And that was really one of the key things that jump-started the whole project. So I knew that with an initiative of this size, we needed to do fundraising. And I enlisted the help of Tamil Canadian Walk, which is an annual fundraising event in Toronto. And they've raised over $500,000 to various charities over the last, I think it's more than a decade now. So I was lucky enough to convince them to fundraise for our initiative. So on September 9th, 2018, hundreds of walkers got together on a chilly Sunday morning to walk for palliative care. I think they walked 5 kilometers. And even though we only targeted 50,000 Canadian, we were actually able to raise 60,000 Canadian, which was amazing. And I'm going to draw your attention to the picture on the corner of the screen. That group is the Senior Tamil Center of Ontario. They are the largest Tamil Canadian seniors group, largest in the country. And I went to one of their meetings and I challenged them to raise 10,000. And I left the meeting not sure of which way it's going to go. But our seniors came through. They raised 13,000 for palliative care in Northern Province, which they became the biggest group fundraisers. So I have to say, our seniors are fearless and they're determined. So if you give them a cause, they're going to get things done. So thanks to our seniors. The update of 2020, so it's been 3 years since this whole project got started. And for the last 2 years, we have had clinics, outpatient palliative care clinics, running in 2 districts in Northern Province, Jaffna and Vavuniya. And alongside that, we have mobile units. These are mobile units, a team of a doctor, a nurse, a driver that will go out into the community and provide much needed end-of-life care at home. And we continue to maintain regular contact with the teams, the Northern Province palliative care teams. We do this by Zoom case conferences. And it's really amazing because you've got these teams that are working in some of the most rural parts of Sri Lanka, and they're able to go over their most difficult cases and get advice from global palliative care experts, and they're advised on best practices. So I think it's a groundbreaking and amazing collaboration to witness. Along with that, we have a WhatsApp group, and that's very active. Members can post questions and get answers in real time. And so you can see how technology plays a really important role in our initiative, and I'm sure a lot of other initiatives going forward. It's important for the teams there to know that they're not alone in this pioneering effort. So we very much want to have them know that they are part of a global palliative care movement. And this hopefully should empower them further and give them more drive. Our dream is eventually to spread to the other districts in Northern Province and hopefully also to Eastern Province. For me, personally, it's been amazing just seeing that a conversation in a conference room in 2017 Toronto has led to this great initiative where this forgotten population of patients are getting the much needed compassionate care that they need as they pass on from this world. So it's definitely been an amazing experience for me and for the other people involved as well. So I just want to conclude. I think I'm going to go back to my beginning quote. The best way to find yourself is to lose yourself in the service of others. And I don't think I quite understood what this quote meant several years ago. But now when I'm at work, I'm fully absorbed in my patient's health concerns. When I'm doing my community work, I'm busy problem solving through various issues going on there. And when I'm at home with my husband and kids, you can see in the picture, I try to be in the moment with them. And I have to say, I don't wake up anymore asking, what am I doing on this earth? What is my purpose? I've come to understand that I define myself by my efforts to help as many people as I can on this earth for as long as I'm privileged to live. And I'm really excited about the possibilities. So I want to thank you for listening to my talk. Oh, yeah, before I forget, I don't know if you can notice this picture in the corner of the screen. Your eyes do not deceive you. That is none other than MIA, the famous UK rapper singer. But I'm sorry to tell you that this conversation took place in 2018. That's when I was chatting her up. Sadly, 9 years after the Save the Doctors initiative, but still she was lovely to talk to. So just a little bit of news there. I hope that I've inspired you to get to work. And before I end off, I think I'll pass it on to Keshi, who's going to play you a video about the Northern Province Palliative Care Initiative. And afterwards, I'm very happy to take questions. So thank you all for being great spots and playing along with my questions.
Perfect. Thank you so much, Dr. Selvakone. I'll be sharing my screen, guys.
Just while Keshi gets set up, feel free to drop any questions you have in the chat box and Dr. Selvakone will get to them after.
Are you guys able to see my screen, if anyone can confirm?
Yeah.
Yeah, perfect. Okay, I'm gonna put the volume up.
பத்தாம் முடிஞ்சு ஓயல் படிக்க ஆரம்பிக்க இந்த கேன்சர் வருத்தம் வந்தாங்க. அதோட ஹாஸ்பிட்டல் கொண்டே விட்டு அவையில் ஸ்கேன் பண்ணி பார்த்து எல்லா இதுகளும் எடுத்த பிறகு கேன்சர் உறுதியாக சொன்னவை. அதுக்கு பிறகு அவை அந்த மருந்து ஏற்றி ரெண்டு ஒரு வருஷமாக எங்களோட பிள்ளை ஃபுல்லாக அந்த ட்ரீட்மெண்ட் ஃபுல்லாக முடித்தவங்க எங்களோட மகள். அந்த ஒரு வருஷம் ட்ரீட்மெண்ட் முடிக்க எங்களோட பிள்ளைக்கு எந்த ஒரு பிரச்சனையும் இல்லாமல் நல்ல மாதிரி தான் அந்த வேதனையெல்லாம் குறைஞ்சி நல்ல மாதிரி இருந்தாங்க. இருந்த பிறகு 11வது மாதம் பிள்ளைக்கு ட்ரீட்மெண்ட் செய்து 13வது மாதம் பிள்ளைக்கு திரும்ப வேதனை தொடங்கி தான் பிறகு எங்களுக்கு ஹாஸ்பிட்டலில் கூப்பிட்டு மேடமாக சொன்னேன் எப்படி இதெல்லாம் கொஞ்சம் கிருமிதாவி இருக்குது சொல்லி சொன்னவே. வேறு எங்களுக்கு உயிராபத்து நறுமணங்களை பயந்துருமெண்ட் அதை பற்றி ஒன்றும் இல்லை. பிறகு தான் எங்கள் வீட்டு டாக்டர் அரேஞ்ச் பண்ணி விட்டாங்க. அந்த டாக்டர் வந்து பார்த்து எங்களை கூப்பிட்டு எல்லாம் கதை கேட்க தான் எங்களுக்கு பிள்ளைங்க எல்லா நடைமுறை பிள்ளைங்க இழப்பாடையெல்லாம் எங்களுக்கு
முழுமையாக ஐஎம்ஐ கனடா என்ற அனுசரணை நிறுவனத்தினால எங்களுக்கு பல வாக்கு மென்மையாக உறவுகள் கட்டில் ஹாஸ்பிட்டலால் ஐஎம்ஐ கனடா அவையினால எங்களுக்கு கட்டில் தந்திருந்தோம். அதோட முதுகில் புண்போடாத அளவுக்கு ஏர் கண்டிஷன் மெட்ரஸ் தந்திருந்தோம். அதனால எங்களை தங்கச்சி வீட்டை ஓரளவுக்கு உடம்புல புண் வராமல் எதனா இருந்ததுதான் புண் வராமல் அப்படி குறைவாக இருந்தவா ஒன்று விட்டு ஒரு நாளைக்கு டாக்டர் வந்து ஒன்று விட்டு ஒரு நாளைக்கு வந்து வீட்டை தங்கச்சி பார்க்கணும், இன்ஜெக்ஷன் அப்படி மருந்து போடணும். பிள்ளைய ஹாஸ்பிட்டல்லாம் கட்டாயம் நீங்கள் கொண்டு வந்து ட்ரீட்மெண்ட் செய்யணும். நாங்கள் இங்கே பார்த்து வந்து உங்களோட தங்கச்சிக்கு சகல இதையும் நாங்கள் பார்ப்போம் என்று சொல்லி எல்லாம் செய்தோம்.
அடிக்கடி ஆறுதல் சொல்லி கொடுக்கணும். இப்படி வந்துட்டு நம்ம என்ன செய்கிறது, மனதை திடப்படுத்தணும். பிள்ளைகள் அப்படி என்று கணக்க முறையில் எங்களுக்கு வீட்டை வர டாக்டர் மக்களும் இந்த மாஸ்டர் மக்களும் மேடமும் எல்லாருமே எங்களுக்கு நல்ல ஆறுதலாக இருந்தது. பொருளாதார கட்டில்கள் சிலிண்டர்கள் அந்த விஷயங்கள் எங்களுக்கு ஆறுதலாக விஷயத்திலையும் வீட்டை விட்டு அப்புறம் பார்த்த விஷயத்திலையும் ஆறுதல் இருந்தது.
So thank you, Keshi. I'm noticing that some people did have any comments. I'm not sure, Dr. Selvakone, if you're able to see in the chat box, but we have, I'm sorry if I butcher anyone's names, but we have Kisida, who said truly inspiring, and Nades, who said great outreach effort, Meera. This will definitely help TARMS members to think of their options in participating in international outreach activities. Lotus also saying feeling inspired. Thanks for the great talk. If anyone has any questions, you can feel free to either unmute yourself or throw it in the chat box.
It's nice to recognize a few people out there. Hi, Nades, how are you?
I'm good. How are you? It's good to hear from you. This is very nice. So I was going to ask, I was going to type, so I might as well ask. So you highlighted some of the difficulties that you face in starting that, what do you think may be the most important challenge for the younger generation if they want to do something in Sri Lanka?
That's a really good question. I think part of it is just getting over our inhibitions about helping out. I think it's just getting started. And one thing I might add is a good way is to connect with Tamil Canadian organizations that are doing work there, and they could sort of ease you into it. So if you're feeling like, I don't know where to start, that might be a place to do it. And it could be IMHO Canada, it might be CTMA, the Canadian Tamil Medical Association. And I know, Nades, you run an organization as well that is looking into science and medical research and all of that. So, so do a bit of research, talk to people, and that certainly helps.
Thank you. I think we have one question in the chat box. Ishita says, hello, Dr. Selvakone. Thank you for your great talk today. With all the work you've been doing for over a decade now, I was wondering if you've experienced advocacy or compassion fatigue, and how have you overcome that?
Yeah, I definitely think it can be disheartening, some of the work that you do, especially if you don't see the results immediately. And I think that's something that we have to overcome as a community. I think a lot of us look very short term and we think answers are going to happen and things are going to get changed right away. And I think over time you start to realize that the wheels have to turn at their own pace. And so I think with me, it is about balance. So recognizing that, I may not see the results right away of my work, and recognizing that it might be 10, 15, 20 years down the road where palliative care, for example, is fully instituted in Northern Province. And then the balance is also keeping myself active with my friends and family and achieving that work-life balance so you don't get tired or overcome. And I think also setting up timelines. I think I mentioned timelines twice. And so you want to have sort of an end point at which you're going to say, okay, well, at this point, I'd like to see this done. And I think if you set yourself short-term goals like that and achieve them one by one, you don't really get that fatigue as much. A great question, Shobita.
We also do have some questions from our Google form when people registered, so I'll just read out those as well. So one of the questions was, have you found that you've had to deal with political barriers to implementing health services and advocating for Tamils living in Northern Sri Lanka? If yes, how do you overcome these barriers?
The answer, that's a really good question. And the answer to that question is yes. We're dealing with a country which had a conflict a long time. And there were definitely two sides there. And I think in my case, it helps to stay away from the politics as much as you can. Because at the end of the day, you do have to work within the rules of that government in that country, and you have to learn to walk that tricky path. So, basically, you ignore it. You go forward. You do the work that you can do. You don't let yourself be intimidated or feel like that you have to change yourself in any way. You have to be truthful and go forward. And so, I personally try not to get the politics get in the way.
Thank you. And another question that we do have is, I think you touched on it a little bit, but someone asked, what were the initial steps you took for medical assistance for tsunami survivors? How did you assemble your team? What were the biggest challenges you faced when providing support for the victim and rescuing the detained doctor? So maybe you can briefly touch up on that as well.
So yeah, I got involved with IMHO. So that was an organization in the US, and I had done a little bit of work prior to that. I was actually interested in going to Sri Lanka during that year anyway. And then when the tsunami happened, I happened to go with the team I was originally planning to go with. In terms of the steps, I think at that time, there was a lot of organizations trying to do work there and trying to see how they could help out. And it was a matter of sort of talking to the different groups and seeing where I fit, where I could help out. So I think in terms of assembling the team, I was actually a team member. The organization itself was assembling the teams to go out. But there was a lot of coordination going on in the background between the groups here and the groups there. So it definitely doesn't help to just show up off a plane and expect to be put to work. You really have to do that groundwork ahead of time and make sure whatever effort that's being done there is coordinated and coordinated with the people actually working there. So you don't become a hindrance, that you are a help and not a hindrance.
Thank you, Dr. Selvakone. Before we do wrap up, does anybody have any other questions? You can unmute yourself. Oh, okay, so I see one in the chat. Darshan asks, why do you think some organizations shut the door or were reluctant to co-sign the Save the Doctors campaign?
Yeah. That's a great question. And some of the organizations that shut the door were very surprising ones. I won't mention any names, but some of them were Canadian mainstream, which I couldn't understand why they weren't interested. I think there was, I guess, a shadow cast by the fact that this conflict involved what was termed a terrorist organization. And so some people were just looking at Tamils as terrorists. And I believe that label did hurt us. But what we tried to focus on was we were getting away from the race. We were saying that these are doctors, they are neutral. Medical discipline is supposed to be neutral, and they're being persecuted and they're being forced to make statements in a political way. So I think once we appealed on that level, people understood and they were willing to join us, and people who could see past other issues, which I don't think was fair to begin with, but I think that became part of the impediment. But I have to say, on a positive note, there were so many groups that joined on that I felt were conservative groups, and I was quite surprised. Not surprised. I mean, we worked on it. We were trying to convince people, but some of them we thought we didn't have a hope in hell of getting them to sign, and we did. And I can say the Canadian Medical Association, we're all, I guess you guys are not a part of it now, but when you graduate, you will become members of the CMA. And they're a very conservative group, and to get them to recognize the truth of what we were saying and the justice behind it was amazing. And I think we have to give credit to individuals and organizations. We talk about organizations, but they're run by individuals. And when you can convince individuals, you can really move forward in a big way. And I think that's what happened with the CME.
Great. I think we've got one more question here. Swana asked, hi, Dr. Selvakone, thank you for the inspiring talk. I was wondering if you could speak to the public awareness and perceptions of palliative care in Sri Lanka, and do you think there is room for more education on what palliative care entails?
Okay. Swarna, I'm so glad you brought up this question, because this is something that we were grappling with early on when we made our trip in 2017, because I don't think there's a lot of public awareness there on what palliative care is. I don't think patients know their rights and what kind of care that they should be allowed, especially at the end of the care when there isn't active treatments going on. So there's a lot of education that needs to be done. And I have to say that there are organizations there, and I'm going to point out CANE in particular, that are doing these public awareness campaigns. They're holding workshops for the public. They're getting in the newspapers there. So they actually are spreading the word. And so I definitely think there needs to be more education. And in fact, we were initially when we went to Sri Lanka, we were worried about the perception from the doctors there. How many of them would be open to the idea of palliative care? Because as doctors, and I can tell you that myself, we are territorial, we want to hang on to our patients. But when we talk to the consultant physicians there and the local physician leaders, they understood, and I think they always knew that this was something that needed to take place. I remember we walked into Dr. Satyamurthy's office at Jaffna Teaching Hospital, the whole team, and he opened with this story about a teenage boy who had esophageal cancer, who died suffering in pain. And he said that one story made him think that we need to evolve a palliative care system in this country and in this province. And so like that, I think definitely more education needs to happen, more public awareness needs to happen, but I'm happy to say that it is happening and hopefully will continue to do so.
So if I may ask one question related to that, in this part of the world, the hospice is a typical thing. Is it a possibility back in Sri Lanka, or is it because in the cultural wise, it's a different type of culture?
Yeah, great question. And you're right, cultural wise, it is a cultural thing that patients die at home and they should be afforded the comforts at home. And that's why our campaign chose to focus on, or at least our initiative chose to focus on home-based palliative care. But you're absolutely correct. There are patients who the facilities at home may not be enough for them, and they may have to move into a situation like a hospice. Because right now, what's happening with those patients is they're ending up in the hospital, which is not a great setting for anyone to pass away. So I know Kane back in 2006 started a hospice, and they've had various challenges along the way. And I believe now there are plans to build a purpose-built hospice in Northern Province that will take care of some of these patients that are struggling to manage at home. And so hopefully that's something that we're going to see in the next few years as the palliative care service starts to develop there. But yes, I think to answer your question short is that a hospice is on the horizon, and I think it's something that is needed.
That's great, great.
Great, thank you, Dr. Selvakone. If anyone has any other final questions to squeeze in before we wrap up, you can just either unmute yourself or throw it in the chat box. And then if not, I'll hand it over to Keshi.
Okay, perfect. Thank you, Dr. Selvakone.
Thank you.
Very, very inspiring for joining us today. I'm sure everyone was inspired by your talks, and hopefully we'll get this global health movement through TARMS going strong as well. And just a few housekeeping notes for everyone. We will be sending out a resource package that the team has put together in terms of palliative care and global health introduction to everyone who signed up. So for your own interest, you can take a look at it. And if you're from Schulich Medicine, you'll need to fill out a separate form to get your academic enrichment program credit recognized. So I'll be sending the link on the chat right now with the code. The code is TARMS. So you'll just need to enter that when you fill out the form. And with that being said, there's one more housekeeping. If you're from an institution that currently has a global health AEP program that's not listed in our current database, please do reach out to us. We're more than receptive to reaching out to these institutions to get our global health programs recognized, specifically for international medical institutions, because we are looking to expand. So our email address is tarmsglobalhealth@gmail.com. So everything will be sent to you if you've registered, and we'll keep you in our subscriber list for our future events to come. As I mentioned, we are planning on having more of these talk series in the future, once a month ideally, but based on the speaker availabilities. And yeah, with that said, thank you once again, Dr. Selvakone. It was a pleasure having you join us today.
And thank you so much for organizing. I really enjoyed. Thank you, everyone.
Thank you. So I should also congratulate the team, the TARMS team and Keshi and everybody putting together this nice series. And I'm sure that you're going to go all the way and make it very, very substantial. A lot of outreach activities. Congratulations and all the best.
Thank you, Dr. Palanier, for joining us. Appreciate that as well. Take care, guys.
Okay, bye.
Bye-bye.
Thank you.